Thanks, Premier. A difficult day in Victoria. We know that we've got new cases in regional areas. Shepparton, certainly we know of many cases. We also have a number of mystery cases across Melbourne who've been infectious in the community for days, in part because they weren't aware that they were primary close contacts. They have tested because they're symptomatic, but they have not been quarantining because they were not known to be primary close contacts. We have really significant challenges with the Delta variant. The number of people who get infected within households is close to 100% in many of the households we're seeing. It moves very quickly. That is now known around the world. And that's very concerning for myself, for the public health team, as are the cases in Shepparton. It does show that regional Victoria is under threat. And it's likely, with the significant movement for essential reasons, to have gone beyond Shepparton. That's why we've declared that all of the current restrictions in metropolitan Melbourne will now apply, other than the curfew, to regional Victoria from 1 p.m. today, and they'll be in place until the 2nd of September. Also from 1 p.m. today, as the Premier suggested, the childcare centres across Victoria are closed, other than for the supervision of vulnerable children and the children of authorised workers. And these restrictions will help us drive the numbers down. They've worked previously. They worked last year if we can follow all of those rules. As you know, there are 5 reasons to leave your home. This will now apply in regional Victoria: to get the food and supplies you need, to exercise for up to 2 hours and no more than 5 kilometres from your home, for care or caregiving, work or education if you can't do it from home, and to get vaccinated at the nearest possible location. You will need to get a permit for authorised work, but there is a 1-day grace period, so that is not required until midnight tomorrow. And the permit application's on the coronavirus website. It'll be updated today when the directions are signed to reflect its use in regional Victoria. Face masks remain mandatory outdoors and indoors, but not at home, unless an exception applies. And that applies to all workplaces and secondary schools. Masks will not be able to be removed to drink alcoholic beverages. We're also recommending, as the Premier said, not mandated, but recommending that children of primary school age also wear a mask in indoor areas. That's particularly reflecting on the Delta variant, on the fact that we've seen significant transmission between young children and the overrepresentation, really, of young children in our current cases. It aligns with the WHO advice on masks. It absolutely aligns with the Centre for Disease Control in the US, CDC, that also recommends masks for children, they say 2 years and above, in school settings. We're talking about primary school children. I'm reflecting on how challenging it'll be for very young children. It is, for that reason, a recommendation. Some kids will do it, some kids will do it well, some kids will absolutely not be able to do it. But as a recommendation, and if your child is able to do that, that will help protect them. It'll help protect those settings where transmission between kids occur. Not every parent will have a mask that's available, the right size, the right fit, but understanding this recommendation, please look into it and see if you can find a mask that your child will wear and that remains something that they can sustain to protect themselves. It is a small but very highly effective tool. We've seen so much benefit from the use of masks, and understanding the significant transmission that happens between young children, we think that can make a big difference as well. But more than ever, it's really important that visitors do not occur to your home. This is where transmission is still occurring. The virus spreads when people gather indoors for prolonged periods of time, and we're seeing it time and time again. These are significant and really tough decisions, but we are buying time. We are doing what we know works, because a transmission saved today is 100 cases, 1,000 cases saved a month from now. That is people saved from hospital, saved from ICU and being on a ventilator, and saved from dying. So everything that we can do at this critical juncture with relatively small numbers, fewer than 400 active cases in Victoria, is a really, really important time to do everything that we know that works. With relatively small case numbers, the effect of higher vaccination coverage is even more powerful. When you've got very substantial transmission, the vaccine will start to turn it around, but it's much more difficult. With lower numbers, with less transmission, getting to that 60, 70, 80% two-dose coverage is a much more powerful intervention to turn transmission around. They are hard decisions, and we know that this is a tough day for Victoria, but we also know what works. So please follow the restrictions. Please get vaccinated. Book in now. This is our golden window to get to the fastest two-dose coverage that we possibly can. And please stay safe. Thank you. Jerome.